So I'm Artemis Teagan with the Artemis Center for Family Therapy, and we're meeting today with my colleague, Dr. Dennis Coffey, who has been a psychiatrist in private practice for over 35 years. He also is with the Los Angeles County Department of Mental Health, San Pedro. I also am joined by my colleague, Ronnie Davies, who is with the Artemis Center, and we're going to be talking a little bit about the health benefits of mindfulness. Since Dr. Coffey is a psychiatrist, we thought it would be interesting to get his take on questions about how we apply mindfulness in clinical practice to help address health issues.
Yeah. Within the public mental health system, the question of integration of physical medicine and psychiatric medicine is the hottest topic right now. The effects of your mind on your body and the corresponding effects of your body on your mind. You know, another big topic is sleep hygiene.
And I have lots of clients, because of their trauma history, that have lots of difficulty with sleep. So what I will typically do is lead them in an open-eyed guided meditation where we do something akin to progressive muscle relaxation. It's just about attending to each section of the body slowly, maybe beginning at the head and working down, just noticing and noticing this section of the body and then this section of the body. It tends to put people in a little bit of a trance state. The idea of this is to teach them that you don't have to fight sleeping or not sleeping. You can attune to your body where it's at, and you can relax whether you go to sleep or not. What ends up happening often, though, is that clients start to attend to what's going on internally, realize they're exhausted because they haven't been sleeping, and they will fall asleep in session, you know. So this becomes a wonderful tool to help them say, look, if you just tune into what's going on with your body physically, like how does it feel, you might notice that you really want to go to sleep. But oftentimes they're somewhere else. I can't sleep, and they're chasing that instead of, wow, I'm actually, like if I just laid here and just paid attention to how my body feels, I'm really tired. And then just succumb to that a little bit. Metaphor that I like to use, particularly again with trauma survivors, is that the ocean waves coming up on the shore, right, are like their traumatic memories hitting them, right? And the sand, the shore can't stop the waves from coming. They have to encounter each other. The land is not going to get angry about the shore, about the waves hitting it, right? So when we have intense, stormy, traumatic stuff coming, right, rather than trying to fend it off or run away from it or in some way manage or to control it, let's let it come, just like that wave is coming onto the shore, and let's see if we can accommodate somehow, just like the sand does. It moves, it accommodates, it is learning how to accept what's coming at it. This is what we're learning how to do too.
Yeah, it's one of your mindfulness principles is to feel it, but don't be judgmental about it.
Right. Yeah, and you know what? Feel it and don't feel like you have to even actually do anything with it. Because the ocean is going to continue to come and go. Your memories are going to continue to come and go, and each day you get to decide, how do I want to feel about this? Do I want to feel anything about it? Do I need to feel anything about it? You know, and if I'm sad or if I'm bowled over by it, that's okay too. You know, I can do that too. It's not forever.
Exactly.
Right? It's just for right now.
But I like to add to that, because I use that a lot to help the more anxious child relax even more, is involve other senses. Do you feel the sun shining on you?
Absolutely.
Where is it? It's giving you a warm, golden light upon you, and that starts to stimulate that cozy, safe feeling of the warm sun.
Exactly, yeah.
And I can take it even further, and they do fall asleep.
Thank you so much. Really important area of inquiry. I appreciate your being here today.
You people have done so well with the patients that I have referred to the Artemis Center that I heartily endorse what you're doing.
Thank you. Thank you.